As many of you know from Instagram, Marley had a CT scan earlier this week. So I wanted to take you through the entire process, starting with getting a little weight. She weighs 110 kilos. After I weighed her, gave her lots of treats to place an IV catheter. I don't have a video of that, but the IV catheter is in her jugular vein there on the left side. This is the CT room. So she is so small, we have to do it under general anesthesia, though most of the time in big horses we can do limbs standing. So here she is walking up to the anesthesia induction stall. We are scanning her left front leg, which is hard to tell in the video, but it's quite short. When we get to the anesthesia induction stall, we need to take some water and rinse out her mouth because the endotracheal tube, or the tube that's going to go in her trachea, needs to go through her mouth. And so we don't want any feed material trapped in her mouth that the tube will pass through and then introduce into her trachea. She's had a little bit of sedation here, but she's still a little anxious about the water coming out of her mouth. But she did a good job. Once we go into the induction box, she gets a little bit more sedation and some pain medication so that any positioning that we put her in the CT, she doesn't wake up with discomfort. We're going to position her up against the wall here. If she were a big horse, there would be a swing gate that comes out from the wall to hold her up against the wall. She's so little that she'd get lost behind that swing gate. Put some eye lubrication in before we induce her and have her go to sleep on the floor there. Now that she's well sedated, I'm giving her the anesthetic induction drugs. In my practice, that's typically ketamine and propofol. And then I will hold her head and she'll be steadied up against the wall to make sure that the drop is very smooth. Once she's on the floor, we make sure to protect the head and her eyes before we open the door into the transfer corridor to the CT area. And now it's time for me to put an endotracheal tube in. In horses, endotracheal tubes are typically placed blind like this, so just by feel. Once I feel myself slide into the trachea, I can confirm that it's in the trachea by pushing on her chest and feeling a breath. Now we're going to hoist into the CT scanner. This is very typical practice. Horses are very heavy. Even she's only 110 kilos. That's a lot to carry. So we put her on the hoist. We hoist them by their legs, typically around their pasterns, which doesn't cause any damage to them. So we're going to hoist into the CT scanner and get in hopefully just the right position so we don't have to do a lot of moving once we're in the scanner, because the scanner sits in a pit, and coming in and out of the pit to do a lot of repositioning can be a bit difficult. Thankfully, again, she's very small, so that makes this whole process significantly easier. So we're trying to get the left front limb down. With her size, that's going to mean that her head and leg both have to be in the gantry, or the circle part of the scanner. So we're going to let her down kind of right where we think the scan field is going to be. We've moved the gantry back to allow us to position her. And we backed up a little. We thought we were maybe too far in. And now we're going to set her down. And then she'll go into left lateral, and that will allow us to position her leg, which is the scanning leg is the bottom leg in this case. So I'm going to crawl out of the pit here so I can get the anesthesia circuit ready to be hooked up. So hooked up the anesthesia circuit, which is delivering the inhalant anesthetic to her endotracheal tube. She's still connected to the hoist here just so that we don't have any issues with her sliding off the table into that pit that you can see. But I'll take her off and I'll start getting some of our additional anesthetic monitoring equipment in place. So I've already hooked up her intravenous fluids, and now I'm going to get ready to place a pulse oximeter and an arterial line, which will measure direct arterial blood pressure. So we use an artery in the back leg in this case, the dorsal metatarsal artery. So I'm clipping the hair above that artery. And I will give that a little bit of a prep so that it's clean. Horses don't typically come to us particularly clean. That spot's pretty close to the ground. So that artery is running parallel with her cannon bone, and I'll just place a catheter, very small catheter in her case, in that artery. And then when I hook that catheter up to a transducer, it will provide an electrical waveform on the screen, and it'll tell me what her blood pressure is moment to moment. So not like a cuff, but real-time blood pressure. You can see the catheter there going in the artery. See a little bit of blood in that catheter. It's coming out quickly because it's an artery. And we'll get the connection system attached. Make sure it's in by flushing it. And then I'll clean that up and secure it with some super glue. That's the easiest way to secure these catheters, just in case there's any movement of the horse. Maybe we have to transport to the surgery OR after we scan. It's not the case here, but we want to make sure it's going to stay in. Then I'll get my transducer hooked up to that, which will transmit that pulse from the artery into an electrical signal so that the monitor can generate an arterial waveform for us. I'm just grabbing it down off the cart there and then attaching that fluid-filled tubing, opening up the stopcock so that we can see. And then I've confirmed the pressure looks good. I will secure that with more tape. There's a lot of tape in anesthesia. We tape everything, particularly in these CT scans where we're positioning kind of awkwardly. So here we're looking at the monitor, and you can see the blood pressure is 98/72 with a mean of 81. Now we've taped her to the table so that we can get that left front foot in the proper position. Her head's also in the scanner. And we had to leave the room. I'm looking through the window right now at the scanner moving back and forth. It takes about 5 seconds to generate a scan. And then we're done and we put her back in recovery. She wakes up. That green line is a little bit of oxygen. She wakes up, stands up, does a very good job of doing that. She looks a little rough, but they get a little sweaty when they're anesthetized. And that's her. She's so small in the recovery stall. Take her out of the recovery stall, head back to the holding stall where she was, and she can have a little snack and a drink. She's just a little wobbly from the drugs, but that goes away. That gives us the opportunity to take a look at the scan, and there in the coffin bone is a nice sized hole that was generated from an enthesopathy where the impar ligament attaches to her coffin bone. So this is the cause of her lameness. Brought her home about an hour later. She's having some snacks and some treats. Bramble is very jealous of this situation at the moment because why is she getting treats? But she's perfectly happy, perfectly comfortable, ready to continue her day. And this process all took about 4.5 hours total. The total anesthesia time, including the positioning and repeating the scan just to make sure we had the limb in the exact right position, was about 25 minutes. And then she got a new salt block because she was such a good girl today. All right, well, that's the process, very abbreviated, of doing a general anesthesia CT scan in a pony. And she's doing well. I'm recording this now the day after the CT scan. She's had some time to graze today, and it's a little rainy, so she's going to spend the day inside. But everything has gone very well with respect to the anesthesia and the scan, and now we are looking at treatment options for her. Thanks for watching. Hope you enjoyed. Bye.